what is the connection between our hormones and inflammation?
Well, I guess the question would be, what isn't the connection between
Mm,
hormones and inflammation? Hormones affect every single system in our body, from our immune system to our cardiac system, our cardiovascular system, to our gastrointestinal system. And so I think, especially as women, we tend to just relate our hormones to, if we're a cycling woman, to our menstrual cycle, or to whether we're going to get pregnant or not, or as we're going, further down the hormonal journey to menopause, and just to, oh, I have hot flashes, so I guess my hormones are dropping. And we never really expand the view, which I'm so passionate about educating, that our hormones are key players. And so it's not just about not getting a regular cycle or having hot flashes. It's about looking at the whole system to make sure our immune system is functioning, to make sure that our arteries aren't getting clogged, to make sure that our brain is not inflamed. And so for the first thing, just if you take nothing else, is just to realize hormones impact so much more than just the things we tend to associate with hormones.
yeah, super important. And you're just like you said, most people when they think about hormones, they think about sex hormones. So we think about estrogen, progesterone, testosterone, which are critical hormones, but insulin is a hormone that manages our blood sugar. Cortisol, is a hormone that helps manage blood sugar and manages our wakefulness in the morning. Melatonin is a hormone that manages our sleep, right? So all of these things critical role in overall cellular physiology and cellular health. And so, what is driving? Obviously, we have an epidemic of chronic inflammation in our society. So, what do you see as some of the root cause factors here driving hormonal imbalances and inflammation?
Yeah, and I just want to, before I answer that question, you bring up, a good point, because I see that all the time when I run hormone tests on patients, and their melatonin is low. And they're like, well, it's okay, I sleep fine. And I'm like, no, 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 it's not okay. Like, melatonin has a really big impact on your mitochondria, has a big impact
Mm.
on your immune system. It's an antioxidant, it's anti-cancer. And so, yes, we have to look very globally at how all these things are affecting. So, what do I think is driving inflammation? I mean, I think we have, obviously, toxins, right? I've been practicing 23 years, and I feel like when I first started practicing, it was more, let's do some testing, let's do some investigating, let's look at your symptoms and see, are you toxic? And now it's totally, I know you have toxicity. Let's just see
Mhm.
how much you have and how much is it affecting your health and your wellness. And so when we're thinking about toxins, so I look at things from a European bioregulatory medicine perspective. So I look at things very terrain based. And I think about the work of Dr. Hans Heinrich Reckewig, who all the heal remedies were founded after his 6-phase homotoxicology. And I think it's a really important, because I think when we think about inflammation, we think, okay, I'm eating an inflammatory food, or I'm not sleeping and that's causing inflammation, or I'm dehydrated and that's causing inflammation. And those are all really important, and we can talk more about that. But I like to look at it like, why did the toxins settle in your body and cause inflammation to begin with? And if we look at his 6 phases, it's really nicely laid out, as the first phase is excretion. And excretion can be anything from sneezing or mucus or sweating or diarrhea or vomiting. And those are normal reactions of the body, but we've been kind of trained in our society to like shut it down, right? We don't want to deal with
Mm.
that. Stop the diarrhea, stop the throwing up. We can't be inconvenienced in our very busy lives. We don't have time. I don't have time for this. Give me an over the counter, give me a pill to make it stop. And what happens is, when we make that stop, we're working against our body. The body is trying to get rid of the toxins to stop inflammation from happening. But if we don't allow those excretions, which are very normal, like I think of it from a homeopathic perspective, this is the psoric miasm. This is someone who can have excretions and lives to be 130, and they're probably still pounding whiskey every day, but they just have a healthy excretion system. And if we don't excrete, then the next step that the body does is inflammation. And so when we think inflammation, we can think anything itis, otitis, pyritis, bronchitis, cystitis, whatever itis you want to put. And this is an acute. So this is not a chronic inflammation. This is an acute inflammation. And this is happening in the connective tissue. And what does the body do then? It spikes a fever. This is our own innate wisdom of the body to raise the temperature, to burn off the toxins. And just like I said with excretion, what do? The kids have a fever. Oh, give little Johnny Tylenol, or, we take
Mm.
a Advil. We don't let our bodies. And as you see, when we get to the last phase, which is cancer, the most chronic inflammation, what I hear, and it's not even like always, it is every time, every single patient I have worked with who has dealt with a cancer diagnosis, and after 23 years, that's a lot of patients I've dealt with helping them with cancer. They all say the same thing. I don't understand, Dr. Stills. I don't understand how I got cancer because I never even get sick. And I'm like, there we have it. You haven't excreted, your body doesn't know how to do inflammation in a healthy way, because there's healthy inflammation and there's the detrimental, long-standing chronic. And this is what then leads us down to the next phase, which is deposition into the extracellular matrix. And we're always so focused on the cell, which is important, but the extracellular matrix, I say, is like the swimming pool that the cells are swimming in. And this is actually the information highway. This is where the cells are getting their information, getting their nutrients, getting their oxygen. This is the way it's getting into the cell, and this is the highway that's cleaning out the cells. And so if we haven't excreted, if we haven't burnt off the toxins, they're starting to deposit into the extracellular matrix. We're getting fascial constrictions, we're getting lymphatic congestion, and things that happen here can be cysts, they can be chronic swollen lymph nodes, it can be eczema, it can be obesity. All of these are forms of inflammation. And sometimes it's silent. Sometimes, we talk about silent inflammation, and sometimes we don't even realize these things are going on, and we think we're fine. I don't get sick, I don't get fevers, I don't have colds, and we don't realize that we're growing illness. So people always find it interesting when they come to see me, and like at the top of my to-do list is like, we got to get you sick. You got to get a good cold or flu. We got to get your body to have a fever. And so we have those first three stages, and then we have what he calls like the biological divide. And then from there, we go into the more chronic inflammation where we have impregnation. And now the toxins are actually inside the cell because we haven't excreted them and so forth. And so now we have more chronic infection. So we can have an itis, but it's more chronic bronchitis. It's just with us constantly. Or we have coronary heart disease, or we have rheumatoid arthritis. And now the cell's function is actually being disrupted. And then from there, we go to degeneration. And so this is considered modern medicine, or mainstream medicine, I should say, considers this irreversible destruction. I don't personally consider anything irreversible because I've seen everything be reversed when you do things from a natural perspective. But here we have like a depletion of energy production, the mitochondria are being affected, enzymatic function is being affected, and this is all due to toxins. And now we're looking at things like Alzheimer's, or COPD, or congestive heart failure. And then finally, we go to degeneration, which typically is expressing itself as cancer. And what's the first thing we do when we see a cancer patient? We look at what is the toxic load. And so we have this excess of free radicals here. We have destruction of organs. We have destruction of tissues. We have the patient in my office saying, I don't understand how this happened. I never even get sick. And so we really have to bring it back to the initial phase, to excretion. And if we want to address inflammation in our body, what are we doing to allow excretion to happen? Are we looking at these emunctories, these eliminatory organs, and are we making sure that they are functioning? That is so much more important than doing a detox. We have to first make sure all the organs are open, or we are just going to create more inflammation in our body.
Yeah, super key. And so toxins as a driving factor, we got to keep all of our systems, our drainage pathways open. Like I always say, we don't want our system to be like a stagnant pond. Instead, we want it to be like a free flowing stream, moving things out. We got to pee, poop, sweat, and exhale, in a sense, toxins out of our body. That's just so important. And you said something interesting there where you actually want people to get a fever from time to time. You want them to get sick from time to time, which is so counterintuitive to our thinking in Western society. We think anything we can do to stop suffering, right? To avoid suffering, which is, really that's the paradigm of Western medicine. And their heart is good for that. They don't want to see people in pain, right? But their idea is whatever we can do to ease suffering. But what you're saying is actually some level of suffering actually primes us and makes us stronger, kind of like fitness. You don't get strong muscles and a strong body unless you undergo resistance, right? And there can be pain associated with that when you're lifting weights, when you're, doing intervals or sprints or something like that. So to build fitness in our physical body, we've got to undergo some level of uncomfortability. And to develop fitness in our immune system, we've got to undergo some level of uncomfortability.
Yeah, I mean, a lot of times I give patients actually remedies that stimulate the granulocytes. They're like apathogenic bacteria remedies that train. It's like, okay, we got to
Mm,
get your immune system in training. So let's get some granulocytic activity going. Let's teach your body it's okay to inflame, right? Because we need inflammation. We need it to turn off. But if
yeah.
we don't even know how to get it started in the first place, and it's always funny because people are always, I remember when my kids were little and now, my grandkids, and what do you do if the kids get sick? What do you give them?
Mm,
Like a hug, a blankie, I just let them be and I let their body do what it needs to do. And I do the same thing for myself. It's like if I feel a fever coming on, I go, okay, let's see. Have I been pushing it too much? Like, where am I
mm,
out of alignment in my rhythm? And I let my body do its thing. And I don't take anything to suppress it because I
mm.
know it's what should be happening. It's a good sign.